India's vast rural expanse, home to more than two-thirds of the nation's population, faces formidable challenges in accessing quality healthcare. Now, the barriers that create significant disparities between urban and rural healthcare are limited infrastructure, shortage of qualified medical professionals, or even geographic healthcare delivery. However, digital health solutions are emerging as a potent force in transforming this landscape, promising to deliver equitable and accessible healthcare to India's underserved rural communities. Hello, everyone. Welcome to the Analytics Insight podcast, where we talk about the ever evolving tech space. And I'm your host, Priya Dialani. Now, the integration of digital health technologies in low resource settings holds immense potential to address healthcare challenges, enhance service delivery, and improve health outcomes. However, the adoption of these technologies also faces unique limitations that must be navigated to ensure their effective and sustainable implementation. Let's welcome Ayush Jain, CEO and founder of Mindbowser Incorporation, to share how mHealth is transforming care access, the practical obstacles to democratization, and strategies to overcome them. Hi Ayush, how are you doing?
Hi, Priya. Doing very good. And thank you for asking. I believe we are in very exciting times. So, it's an exciting day every day.
Definitely, Ayush, and it's a pleasure to have you on our podcast today. And I think we are going to unlock a lot of insights around mHealth and its role in India specifically, and how does the future look like with these emerging technologies playing such an important role and impacting healthcare overall. So let's start by telling our listeners more about, Mindbowser Incorporation, a very interesting name, and I'm sure our listeners would like to know more about it.
Sure. So Mindbowser is a health IT product engineering and consulting company. We are focused on building healthcare products, working with healthcare organizations, help them modernize with digital solutions, and provide end-to-end development and support practices. Because what happens in healthcare is there are many point solutions that exist, but because of these point solutions, again, things are not connected to each other, which then becomes a big barrier to the effectiveness of any solution. So where we specialize is in the end-to-end, platform or practice management, from strategy to design to development to AI enablement to even compliance. And one of the big deep focus area of our company is the interoperability piece. So integrating with health systems and even national health infrastructure, etc. So over the years, we have delivered like 100 plus healthcare projects globally. And our mission is primarily to build connected, scalable healthcare solutions. So you asked about the name. So Mind Bowser, that is actually more of our imagination as a hustler, to be honest. So like I and my co-founder Praveen, we actually, when we started the company, we were actually figuring out names on GoDaddy. Like that's how you used to figure out names a decade back, like what all combinations are possible and available on as a .com domain. So we are combining words, and we all know what is mind. The Bowser word basically comes from the oil and gas industry. It is primarily a funnel where basically you different inputs or different oils together to create the right mixture that is then usable. So that was the inspiration of the word. Though a couple of years back, my children took me to a Mario movie, and I also figured that the villain is called Bowser, that I was not aware earlier. But we stick to the oil and gas innovation side of it. So that's where Mind Bowser name incepted.
Really glad to know about it, Ayush, and thank you for sharing that. And I'm really glad to see how the specialization of company has evolved alongside the industry demands, moving beyond traditional solutions to a more intelligent, scalable, and future-ready offering. Having said that, Ayush, we would also like to know more about you. You are an accomplished tech entrepreneur, author, and visionary leader driving digital transformation initiatives across industries. And with a relentless focus on innovation and client success, you have carved a niche in the technology space, guiding businesses to thrive in the digital era. So, how has your journey been till date, Ayush? If you could, help our listeners also know about it, and what exactly is your role at the company today?
Sure. Yeah, I mean, very deep question with many layers, I would say. So primarily, as a startup founder, like I and my co-founder, we started the company like around a decade back, and this was pretty much like straight out of college. So in that sense, like learned all my lessons in the field, and primarily my role as a CEO of the company has been more towards the strategic side of things, the understanding of things, and understanding trends, customer insights, understanding the voice of customer. I've in fact over the years learned and tried to become a better listener all the time. So those things are, to be honest, is my role in a day to day, like figuring out things or finding patterns, because for everything else, as a growing company now, we have like leaders, we have different departments and so on. But as my role, it remains to connect all these systems together and connect that with outside perspective or outside trends and bring them, for consumption internally. So that remains primarily as my focus. Overall, I would say, working in healthcare again, healthcare is a very unique industry, to be honest. So technology is especially not something, like a practitioner in healthcare would think of as the first thing, or even the end user, like the patient, would think of as the first thing. So it's like more focused on care and everything. But you talked about rural health, especially. So the role of technology really comes in to make things more scalable, more like pragmatic, or more accessible, decrease cost of things, and so on. So create a win-win for everybody in the ecosystem. So that's how I believe, more and more my role evolves into connecting these things together, both for internal teams as well as for customers, that how technology can really help them to improve care delivery, to reduce administrative burden or better data flow, and, helping them find the answer to the why. So that's what I thrive in, like, helping our customers figuring out the why of anything, and why they should do so, why they should look at this thing, and so on. So my contribution is really about making sure we are not just building technology, but overall we are really building impactful solutions for the society, for better outcomes, for better livability. So that's where I see myself.
So glad to know about it, Ayush, and thank you for helping us, go through your role, and it clearly justifies it's beyond title and function, and you are clearly, shaping the direction and impact of the company, and of course the overall vision that you shared with us. Moving ahead, cutting edge technologies are, converging with healthcare, and mHealth, based on hyper-connected intelligence, is leading the paradigm shift in medical care. Many countries have already entered this super age society, and the proportion of gross domestic product expenditures for medical care is increasing due to an upsurge in the number of people with chronic diseases. And in addition to that, the excessive demand compared to the available supply, the lack of healthcare infrastructure, and the unbalanced distribution of medical staff are also creating a lot of problems. And I think mHealth is a strong candidate to make the prediction, prevention, and management of these accessible medical services more personalized. Of course, with the integration of artificial intelligence. So I think the ultimate goal is to dramatically improve the standard and satisfaction of living by providing quality services at affordable prices. And mobile health has been positioned as a breakthrough for accessibility. At a high level, how realistic is the promise of mobile health in truly democratizing the quality healthcare?
Right. True. I mean, totally agree with it. I would, in fact, seeing the trends in healthcare for over a decade now, I can say that, the promise of mHealth is very real. In fact, like pick an analogy that, when smartphones basically first came in and we moved from an era of internet, big leap from desktop to handheld, basically Uber was born or Airbnb was born. So, a lot of these companies were only possible because such a technology transformation happened. I believe that similar to this, today with the AI, coming in, I think mHealth truly becomes transformative because without AI and without context, AI like ML that always existed, but the scope was very limited. The idea was probably just logging your vitals, for example, or being able to, let's say, get a nudge for your appointment. Very limited use cases, basically. But now with AI, I believe that just like you said, the promise of mHealth in democratizing quality healthcare is now very real. We can now move beyond basic tracking applications into these intelligent, personalized care support. I believe that, in fact, earlier I believed that it may be like near future, like by 2030 or something. But now with, every day how AI is evolving, I would say it would be as near as next year that everybody would have a personal doctor basically. So everything goes into one window, which is like your personal doctor. Maybe it is endorsed by your hospital or let's say by tech, etc. And everything just goes into one window, like your vitals, your lab reports, your things, so that you get better context awareness, you get better, let's say, like recommendations, you can chat. In fact, there is a report that I was reading some time back from MIT in the US that, people, like there was this experiment that people were given two options. Like one was like work with a human doctor, and other was like primarily discussing with AI their symptoms and everything. Over a period of time, they found that more people actually inclined towards using the AI bot rather than the human because now they can share without judgment. They can ask as many silly questions they want. They can, really access all the time, like at 2 a.m. in the night, and they just feel, hey, maybe this thing is not letting me sleep. This thought, is it like something big or is it something just a headache, for example, and, get those recommendations. And because AI is the first time that all of this information connects, I believe that this is really transformative. This will really be one big thing coming out, as we are transforming into a AI technology landscape. So I believe democratizing healthcare is realistic and AI will make it possible sooner than anybody of us will think. It is just happening every day.
Definitely, Ayush, and I think you've shared some really important perspectives. And I think democratization isn't about putting an app on a phone. It's more about digital literacy, trust in the system, data privacy, and whether frontline healthcare workers and clinicians are actually equipped to use these tools effectively. And I think the balance between technology, human in the loop, and system readiness feels very critical to whether mobile health can truly deliver on its promise. And while saying that, I think when we're talking about the integration of smartphones and how everybody is becoming so digital savvy, mobile health is less widely used than expected, unfortunately. Wearable devices are relatively more optimized for continuous and real-time healthcare sensing, compared to smartphones. However, the
Mhm.
penetration rate compared to smartphones worldwide is pretty sluggish. A smartwatch, a representative wearable device, should be or needs to be connected to a smartphone to operate. So
Mhm.
users do not recognize this wearable device as an independent entity, and independent use is required to be fully positioned as a complete separate device. And these devices lack effectiveness because due to reduced user convenience, probably because of the small screens, poor battery performance, low usage rate, also even high price, I would say. So access is often, confused with availability. How
Mhm.
do we ensure that mobile health improves the quality of care and not just the reach or convenience?
Right, right. I mean, rural and underserved regions do present, infrastructure challenges. I agree with it, but I believe that mHealth can still be very effective, and that's where the role of innovators and technology companies, for example, really comes in. To create thoughtfully designed experiences, or to really create technology that is able to work in low latency, for example. Those are in fact the kind of decisions as mind at Mindbowser we take every day, like understanding your user and then figuring out better experience for them. So I believe that like this can be solved. Again, there are already some technologies that exist, some solutions that exist, like you could switch to more like a SMS based care, you could switch to more like offline first apps and so on. I'll again compare it with again, the revolutions that we had, say, again, with Uber or with e-commerce, with Flipkart and Amazon. Like, everybody thought that how would the postal codes be mapped, or how would people pay, because most people do not have credit card. Those were the problems that in 2008 people were sitting on, when they were thinking about building solutions. But I believe that's where, I'd say rather is the green field or the great value add from people that create startups, people that are crazy enough to go beyond what exists. For example, I believe that this will get solved overall. It would be just about like, and I believe like while we are talking here, somebody could already be working on this. So this will get solved. Experience is something, it does not seem to be a unsolvable problem. I believe that the goal would remain to keep patients connected to the care system in whatever way is feasible. And there would be always hybrid models too. So combining like community health with digital support. So it may not be standalone also. It could be like a hybrid ecosystem. Maybe this would be called healthcare. Like today we have two different definitions. Like one is telehealth and one is hospital care, for example. Maybe we will see that, okay, all of that has become one only. It's like, an obvious experience that, one, you visit, but second, you remain connected kind of thing. So even in low resource settings, I believe mHealth can bridge gaps through simplicity, accessibility, smart designs, and of course, the cost of hardware is also coming down. I think India is, in fact, a place where penetration of smartphones, is one of the top, I would say, among the world. And I can also think of an analogy taking from WhatsApp, for example. So, like an innovator can think wherever WhatsApp is, my mHealth would become available, for example. Maybe care could happen through WhatsApp kind of interface also. So these are all the different possibilities I see which should be able to solve these challenges.
Yeah, I think the distinction you made is really important, Ayush, because in healthcare, access without outcomes doesn't really, actually move the needle. And I think convenience is only valuable if it leads to better care and a more
Yes.
informed patient, I believe. And I think that's where mobile health, it moves from being a tool for reach to becoming a true enabler for, healthcare quality and the overall impact, I would say. Moving ahead, when we're talking about healthcare, I think chronic diseases, are it's one of the most talked about a field in terms of
Yes.
healthcare, and it's because they have severe consequences for those affected.
Yes.
In addition to reduced quality of life, it also leads to more health emergency or serious complications and sometimes even death. And the management of chronic diseases is among the many costly challenges faced by the healthcare sector, because each year chronic diseases accounted for almost like 71% of the deaths globally. And it
Right.
also contributes to inequality or even disproportionately affecting the socially disadvantaged people. So there are a lot of
Yes.
challenges and complications when we talk about chronic diseases. So, do you think mobile
Mhm.
health can address this a chronic disease management challenge and and preventive care at scale? And if you can support that with any evidence or real world outcomes, if you're seeing.
Yeah, absolutely. Chronic disease management is, in fact, one of the strongest real world use cases for mHealth, because, like conditions like diabetes, hypertension, asthma, or even behavioral health requires continuous engagement. Like there's a reason they're called chronic, that, like these are patients who have multiple visits required, for example. Now, the missing piece today is that, and I can tell from my own experience with having my both parents, suffering from old age, diabetes, hypertension, and other stuff. So, like what is happening till now is more like that, they have, let's say they go to a doctor, they get some prescription, they follow that prescription, and they go back to the doctor, say, after 6 months. The missing piece is that there is, no real monitoring that has existed, between these episodes of care. So, they said yes to everything to the doctor, for example, and the doctor said, okay, take these medicines and then come back to me. And then, there's no real interruptions or any sort of intervention window available, without mHealth. Now, where the world would move is, how about as a physician to you, I meet you, I talk about you and give you all these prescriptions and everything. But I also give you this application, for example, that, on a day to day keeps on monitoring the vitals that I require of you, and does it in a very natural way that you may not even need to, let's say, even get reminded about it, for example. And then, maybe in 15 days or 20 days, maybe based on the data that is collected, if there is any abnormality, that is found, or there's any spike found, a quick message can go to the hospital or to the physician that, hey, out of the 100 patients, maybe these two people need to be checked again. Or maybe to the patient that, hey, we know that your appointment is on such and such date, but your data shows that there is this spike. So why not you go back and meet the doctor? So things like that, experiences can bring the overall quality higher, which means, early intervention before complication rises, lesser people required to be admitted to hospital because proactively some steps can be taken, and, like automated follow-ups, care gap closure. So, or, even preventive outreach can be done at scale. So I believe that chronic care is, in fact, like the future is going to be this proactive and continuous way. And mHealth, especially with this AI support, would be a key enabler of that shift.
Definitely, Ayush. And I think mobile health or mHealth is no longer just about access, it's more about the continuity of care.
Yeah.
And what you have
Yes, yes.
described
It's
shows,
about the important data that exists
yeah,
outside the hospital. So
right,
today
right.
we are working on connecting these data points. In fact, you asked me about, some real world work, for example. So in fact, we already have a solution called Today Health in place. That's a product from Mindbowser, which is focused on monitoring care and the vitals for cancer patients. So the solution is focused just for cancer patients, for whom weight management and vitals, are important. So, it comes with basically a platform and a variable piece, basically. So the variable piece, once a day, the patient can wear, and all the vitals basically go into the system that can then be just like I described earlier, that, any spikes or any abnormal data would get reported to the doctor, and, all sorts of care would be taken care of. So we have a solution there, and already we are serving two clinics that are managing in total around 500 lives through that solution.
Yeah, definitely, Ayush. And I think that's where, we are seeing the shift of mHealth from just being access to giving more on health support, where
Mm.
patients are guided not during just illness, but also like throughout their everyday lives. And I think that naturally leads to me to think, what it takes to sustain this impact as the adoption grows. Because the lack of interoperability and standardization in digital health systems can hinder their effectiveness. In low resource settings where diverse technologies may be in use, ensuring seamless integration and data exchange between different platforms becomes essential for a very coordinated healthcare delivery. And inadequate data security measures and concerns about private breaches can undermine the trust in these systems. So,
Right.
like we discussed, I think you also mentioned that how interoperability is one of the challenges that
Yeah.
Mindbowser is trying to solve. How important is the integration with hospitals, labs, or even the national health systems for mHealth important to succeed?
Right, right. I mean, of all the different possibilities that I just shared, they can only become possible when, data is connected. Because, as they say, garbage in and garbage out. And with AI, in fact, it would be garbage in and truckloads of garbage out. So, we create that data layer or that interoperability layer where we are putting in the right input. Rest of the pieces will not fall in place. Like we just then miss the opportunity that AI creates. So I believe building the future would have interoperability as that absolute foundational piece. Because mHealth cannot succeed in isolation. It must connect to hospitals, to labs, to national health systems, to insurance, even. So all those things become important. And, because if you don't have that, you end up with pretty much the fragmented data and disconnected experience, and then you are back to like not getting the value, and then people don't use it, the same old problem basically. So the idea would be like, whenever building any such solution, you have to look at connecting the whole piece, within the hospital, outside the hospital, with the variables, with the access, and so on. And the good news is that there are standards available. Like at Mindbowser, we are using FHIR fire standards that are globally accepted now, and HL7 standards, and a lot of progress is happening. That is the good news on that side of world, I can tell you. So connected ecosystems, I believe, would what make mHealth really scalable and trustworthy. Because just like we use, different systems today, it delights our experience when things fall into the way we expect it. I believe let's bring same experiences towards wellness and health as well.
Yeah, definitely. And, I think that's really important because mHealth doesn't operate in isolation. And what clearly comes through is that, interoperability isn't just a technical checkbox, it's foundational to trust, continuity of care, and even real world adoption. And I think over a period of time, it will become the backbone that determines whether, mHealth solutions remain those incremental tools that can help upscale platforms and transform the healthcare delivery. And I think with the digital health growing, I think it's become a very key, bridge between the rural and urban India healthcare. And its strategic implementation is very important for high quality healthcare at the doorstep of those who need it the most. So, if you could quickly help us wrap up our conversation as to how do you think would be the next phase of mHealth like?
Yeah, I mean, I think, like I said, this is like the big moment for mHealth. I believe that next phase of mHealth is moving from apps to intelligent healthcare primarily. So it would just not be like a mobile application only, for example. So I believe that good news would be that everyone will have a kind of personal health co-pilot, AI-enabled assistant that can, like really give answers, help coordinate care, monitor health continuously, guide you, so all those things would happen. And with AI agents coming in, so we'll see a lot more agentic automation supporting hospitals, like reducing their burden in terms of streamlining follow-ups or intake of the patients, or improving care coordination. So for both hospitals and for patients, mHealth is going to make a total change in the way we are used to today. And the future is not just digital access, I would say. Rather, it will be like always on personalized healthcare that blends seamlessly into everyday life. So it would become, just like you're keeping your mobile phone every day. It's like so simple as that. And it would not be just a tool, but actually an integral part of how care is delivered, how care is experienced. So and like I said earlier, this is happening by next year. It's not very far.
Definitely. And I think as mobile phones are ubiquitous, portable, reliable, and increasingly accessible, there is a great promise and potential for them to influence the democratization of health. Of course, we need to focus on the infrastructure of health systems, technology, and I think all these stakeholders need to come together to ensure that we are delivering the long-term value. And I think now is the time where we can improve the healthcare delivery in low resource settings. Thank you so much, Ayush, for taking out the time and effort and helping us understand that mHealth, mobile health is uniquely positioned to address the unique challenges with limited resources and accessibility. Of course, collaborative efforts involving healthcare providers, tech developers, and local communities are very essential to harness the full potential of digital health and improving health outcomes and advancing healthcare equity worldwide. Thank you so much for your insights, Ayush. It was lovely chatting with you.
Same here, Priya. It's a pleasure to be on your podcast, and I hope I'm able to provide some useful insights to the audience.
Yes.
So, thank you so much for organizing this podcast.
Yes, yes. Thank you so much, Ayush. This is for our listeners. I hope you enjoyed today's discussion around mobile health and how it is transforming healthcare delivery and being one of the core drivers of addressing the healthcare challenges in low resource settings. Stay tuned for upcoming podcasts, and you can view all our previous podcasts on Spotify and other leading platforms. Thank you so much.